Thank you, good people. Thank you. Welcome, 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 welcome. The show is Health Access. My name is Akin Fadeyi. I'm health insured. Are you health insured? Yes! Today, we're talking about increasing coverage. What is increasing coverage? Today, on this program, we have with us National Health Insurance Schemes, GM, Research and Planning, Dr. Thomas Bode Adeoye.
Thank you. Thank you. Thank you very much. Thank you.
Dr. Adeoye, I want us to cut to the chase. Coverage mandate is 30%. You guys gave yourselves an increased target, 40%. Is it realizable?
Okay, thank you very much, Akin. First, let's look at what...
I'm here. I beg of you to please raise your right hand. And repeat after me. I, your name,
Dr. Thomas Bode Adeoye,
promise
to
tell the truth.
To tell this truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
So help you God.
So help me God.
You're welcome.
Thank you very much, Gbenga. How many truths have you told today, Gbenga Adeyinka?
I've not started saying anything yet.
Is it realizable?
Realizable.
Tell Nigerians how
it is realizable.
To do that.
It is realizable, it is doable, and we shall be there together. Let me tell you why, Nigerians, we thank you anyway for this opportunity. Let's just take our minds back into 2005, when the World Health Assembly, that is the conference of ministers of health all over, like 200 member countries, came together and urged all countries to make sure that there is universal health coverage in their countries. Now, we are signatories to this. So politically, we are part of this convention and it must happen. Number two, in Nigeria, March 10th, Nigeria committed, during its presidential summit, committed to a declaration that Nigeria will march towards universal health coverage. And they made a lot of declaratory points to the fact that Nigeria will be covered, all Nigerians will be covered. Number three, structures have been set up, institutions have been set up. For example, you have National Health Insurance Scheme, you have Federal Ministry of Finance, you have Budget Office of the Federation that provides the money. So these institutions are available. You have Ministry of Health, you have stakeholders that are already registered. You also have organizational capacity, that is, National Health Insurance Scheme workers are qualified people, they have different professions, the actuary, very relevant in health insurance. They have business administration people. They have all kind of medical and health related courses that will assist in making sure that increasing coverage will be possible. Therefore, when the president gave us a mandate of 30%, we said, look, Mr. President, to ourselves, that 10% on top of that, that 40% we can achieve it in the next 2 years.
Mr. President, 30%. You people added 10%.
Yes.
Are you sure this is not initial excitement? Have you considered that Nigeria is largely large? Have you thought of riverine areas? Have you thought of places that are motorable? Have you thought of places that boats can't get, that only boats get to? What were you considering when you came up with this 40%?
Well, first, what is 40%? 40% translates to like 70 million Nigerians. As of today, our coverage is still single digit. So we're looking at 2 digits, 70 million Nigerians to be added to whatever we have. And then we know that we have had some experiences, having started with the federal workers, and then some pilot schemes in the communities. And then we started other programs like voluntary contributors. So we have actually tried to update ourselves. We've tried to take these experiences. We've also compared with international experiences and successes, even in Ghana that have reached 60%, or Rwanda that is like 90%, and other developing countries, and studied the ways in which they went about this. Despite the challenges of topography that you mentioned, that is not a problem for us in Nigeria because we have got our staff located in all of these places.
A round of applause for NHIS. Thank you. We'll be going on a segment break now. The program is Health Access. My guest is Dr. Thomas Bode Adeoye from National Health Insurance Scheme. We'll be right back. Don't go away.
Thank you.
My wife fine yo, she no get part two. She fine pass oyinbo queen, no rival.
Baba, your wife is coming.
Hospital bill.
Da kin yi register the NHIS. Da yanzu ba kya asibiti bill. Ìbáṣepé wọn náà ti darapọ̀ mọ́ ètò ìlera adójútòfò NHIS ni. Ó ní máa pariwo owó hospital.
Ọ bụrụ na ị dere aha gị n'akwụkwọ ndị NHIS, ị gaghị nara ebe a na-eti mkpu the hospital bill.
And my dreams dey always come true. I dey go register for the NHIS.
You go school? Wetin you know about the SEs?
Na NHIS government don dey arrange better thing wey you go benefit from. Me and Linda, we no go dey suffer for hospital bill again. I dey go register for the NHIS. Now, everybody can register. Bus driver, mechanic, trader, anybody.
Easy access to healthcare for all.
Welcome back. The show is Health Access. Dr. Adeoye, health insurance in Nigeria. Yes, we have an idea of what it covers on this program. Does health insurance package cover psychiatric patients?
Yes, it does.
HIV patients?
Yes, opportunistic infections.
Under what package?
Well, under the benefit package, if it is HIV patients, you know, government also has its own vertical programs where drugs are already made available for the access of people with HIV. Now, but for the opportunistic infections, if somebody comes to the hospital under NHIS, he will be taken care of. But to get his antiretroviral drugs, he will now have to go to those facilities that government has already made available, you know, where these things are subsidized, these drugs are subsidized, and they get their drugs. But the opportunistic infections are taken care of.
Okay, I have a question.
Yes.
I've heard of the different kinds of programs you have, or let me say policies now, so that people understand. But I've noticed that by and large, if you're in the if you're not in government employment, there's something called the voluntary, what do you call it? Voluntary contributors system.
Yes, program.
You will notice, and I think it's been proven statistically, that majority of Nigerians are low-income earners. And we're saying this voluntary contribution is 15,000 naira. It might be difficult for some people to throw 15,000 naira down at a go. Does NHIS have plans in place for staggered payments?
Thank you very much. It's as if you work in NHIS. As a matter of fact, we have started a repackaging of this voluntary contributor social health insurance program. One, to make sure that people can be able to do instrumental payment. Maybe 2-3 times a year, that will just suffice. Number two, we've also tried to say anybody who cannot pay, that we encourage people to pay for them. Number three, we also want to, we know the moral hazards that are associated with voluntary contributors, because everybody who is usually likely to be sick, the risk, high risk, we always want to go there, all right? But so we are encouraging family registration, whereby the father, the mother, you know, and maybe a kid will register. Usually it is the women that are very, very vulnerable because of the way God has created them, or sometimes when they are reproductive age, or when they are pregnant, or they're about to deliver. These are the danger areas within their life cycle. So we want family members to register so that we have enough fund to be able to cross-subsidize each other.
The program is Health Access. My guest is Dr. Bode Adeoye from NHIS. We need to take health tips from an in-house doctor now. We'll be right back. Don't go away.